Good evening. Welcome to another edition of the 411 Talk Zone radio show. My name is Leon Jones. Now, here's what I'm going to do tonight since I did not have a live stream for the second straight week because I had some engagements with school. I'm going to do a pre-recorded video tonight. Now, next week, I will go right back to the same schedule. I will live stream next Wednesday at 7 o'clock Eastern Daylight Time. I will post the information in my community section on a 401 Talk Zone radio show channel. Now, also for your viewing pleasure, I did upload 2 videos today on concrete field testing. One of them, the camera slipped out of my hand. I caught it, just a small glitch, but you can watch how the procedure takes place. Now tonight, I want to share this topic with you because I see a lot of it. It's called delusion. So I'm going to title this video, Is Delusion a Psychotic Disorder? Is delusion a psychotic disorder? Now, when we deal with anything related to a psychopath or psychology, Machiavellianism, we start going down the road called the dark triad, where it's a triangle that's included 3 legs. It's a triangle with 3 legs. And the 3 legs are narcopathy, psychopathy, and Machiavellianism. Now, all 3 of those behaviors are relevant in what I see today. Now, when we talk about delusion, is it a fantasy? Are people overinflating themselves? Because delusion, although it can be a disorder, delusion is also a form of deception. And why is it a form of deception? Because it's a situation. I'm not a psychologist now, so I'm going to utilize my opinion based on what I've read. Delusion is a form of deception. Now, a number of people use delusion to overinflate their value. Now, I'm going to share my screen and I'm going to break it down for you as I talk about delusion. Now, when we deal with delusion, let me go right up to the top here. I'm going to give you the definition right now. I gave you a rough definition of delusion. And I got my definition based off what I see in the real world and on some of these YouTube videos. But when we talk about delusion, I'm going to go into it a little deeper. I'm going to say delusional disorder. Now, a delusional disorder is a mental health condition in which a person can't tell what's real from what's imagined. So there are many types, including persecutory, jealous, grandiose types. Now, with delusion, it is treatable with psychotherapy and, of course, medication. Now, again, what is a delusional disorder? It's a type of psychotic disorder. Now, its main symptom is the presence of one or more delusions. Now, let's break it down and give you a definition of what a delusion is. Now, basically, a delusion is an unshakable belief in something that is untrue. Why? Because the belief isn't part of the person's culture or subculture, and almost everyone else knows this belief to be false. So when people talk about something that's not true, most of the time, is it based off of impulse? Is it a lie? Is it a deception? Well, let's delve into it a little deeper. People with delusional disorders often experience non-bizarre delusions. Non-bizarre delusions involve situations that could possibly occur in real life, such as being followed, deceived, or loved from a distance. Now, these delusions usually involve the misinterpretation of perceptions and experiences. Now, in reality, these situations are either untrue or they're highly exaggerated. Now, when it comes to delusions, there are two types of delusions. There are non-bizarre delusions and there are bizarre delusions, and they're both different. Now, non-bizarre delusions are different from bizarre delusions. Let me back it up, slow it down a little bit. Non-bizarre delusions are different from bizarre delusions, which include beliefs that are impossible in our reality, such as believing someone has removed an organ from your body without any physical evidence of the procedure. Now, people with a delusional disorder often continue to socialize and function well apart from the subject of their delusion. Generally, they don't behave in an odd or unusual manner. Now, this is unlike people with other psychotic disorders who also have delusions as a symptom. Now, in some cases, however, people with a delusional disorder might become so preoccupied with their delusions that their lives are disrupted. Now, as I said earlier, there are different types of delusional disorders. So, what I'm going to tell you right now is the types of delusional disorders are determined based on the main theme of their delusions the person experiences. So the types of delusional disorders include erotomanic. Now, an erotomanic disorder is people with this type of delusional disorder believe that another person, often someone important or famous, is in love with them. They may attempt to contact that person of the delusion and engage in stalking behavior. Now you have the grandiose. Now, people with this type of delusion disorder have an overinflated sense of self-worth, power, knowledge, or identity. They may believe they have a great talent or have made an important discovery. Now, the grandiose delusional disorder is one that a lot of people have. They don't know it, but this is where the individuals definitely overinflate themselves, and it almost becomes a point to where they have lied to themselves and they have fallen for the deception without even looking at their own situation or any other facts of what's real and what's not real. Thirdly, there's one called a jealous delusional disorder. Now, people with this type of delusional disorder believe that their spouse or sexual partner is being unfaithful without any concrete evidence. Then you have the persecutory. Now, people with this type of delusional disorder believe someone or something is mistreating, spying on, or attempting to harm them, or someone close to them. Now, people with this type of delusional disorder may make repeated complaints to legal authorities. Now, this disorder is more like, I'm going to say, paranoia. And I did a video on paranoia a long time ago, where you believe somebody is, when I say spying, there's also a belief that they're being stalked as well. So again, people with this type of disorder I'm going to say this. You have to really get out of your feelings and look at the whole picture before you make any type of rationalization that someone is attempting to harm you or spying on you. Now, this could have also come from nightmares, because some of these disorders do come from nightmares. Now, I'm not saying that these aren't problems, but when it comes to persecutory delusions, I look at them more from a case of paranoia. Because again, when people make these types of complaints to legal authorities, they could be false claims. And the problem with false claims is you waste time when you make these complaints to legal authorities when they could be out there taking the time to work on real complaints. Then you have the somatic. Now, people with this type of delusional disorder believe that they have a physical issue or medical problem, such as a parasite or bad odor. And then we have the mix. Now, the first, I want to say 5, well, when they're mixed, it could be 2 or more of the first 5 that are combined. Generally, I'm just going to say this. A delusion is a delusion no matter what. And living here in America, a number of people do live in a delusional world. They're not realistic about where they want to go in life. They believe they have something when they don't have something. And a number of individuals who live through delusion are trying to make themselves feel good in a situation that they're in that's not good. That's why they overinflate themselves. So, what is the difference between delusional disorder and schizophrenia? Now, schizophrenia is a spectrum or range of conditions that involve psychotic symptoms, which include disorganized speech or behavior. Negative symptoms, which include a decrease in emotion in a person's facial expressions and motivation. Now, a delusional disorder is different from schizophrenia because there aren't any other psychotic symptoms other than their delusions. Now, in addition, in contrast to schizophrenia, delusional disorder is relatively rare and daily functioning isn't as impaired as it is with schizophrenia. So, who does the delusional order affect? Well, people often have these occurrences in middle to late life, with the average age of onset being 40 years. Now, the persecutory and jealous types of delusional disorders are more common in people assigned male at birth, AMAB, and the erotomanic type is more common in people assigned female at birth, which is AFAB. Now, people who tend to be socially isolated are more likely to develop a delusional disorder. Now, these populations include immigrants who have language barriers, people who are deaf, people who are visually impaired, and elderly people. So the question that has to be asked is, how common is a delusional disorder? Although delusions might be a symptom of more common disorders such as schizophrenia, a delusional disorder itself is rather rare. So approximately 0.05% to 0.1% of the adult population has a delusional disorder. Now, they may have a delusional order, that real small minority, but I will tell you this, there are a number of people who are delusional in their thinking because they do not look at what's going on in the real world. They think from fantasy. So the question is, what is the most common type of delusional disorder? Well, the most common type of delusional disorder is the persecutory type, when someone believes others are out to harm them despite evidence to the contrary. So, breaking it down, what are the symptoms and causes of a delusional disorder? Well, the presence of delusions is the most obvious sign of delusional disorder, which vary based on type. So, another characteristics or correction, another characteristic of this condition is that the person often lacks self-awareness that their delusions are problematic. Why? Because they're unable to accept their delusions and they're irrational or inaccurate, even if they recognize that other people would describe their delusions this way. And this is a fact. There's going to be anger and violent behavior could be present if someone is experiencing persecutory, jealous, or erotomatic delusions. Now, people with delusional disorder may also develop anxiety and or depression as a result of the delusions. Now, early symptoms of delusional disorder may include feelings of being exploited, preoccupation with the loyalty or trustworthiness of friends, a tendency to read threatening meanings into benign remarks or events, persistently holding grudges, and a readiness to respond and react to perceived slights. So, breaking it down again, what causes delusional disorder? Well, as with many other psychotic disorders, researchers don't yet know the cause or the exact cause of a delusional disorder. So researchers are, however, looking at the role of various factors that may contribute into the development of the condition, including genetic factors. Now, the fact that delusional disorder is more common in people who have family members with delusional disorder or schizophrenia suggests there might be a genetic factor involved. Researchers believe that, as with other mental disorders, a tendency to develop delusional disorder might be passed on from parents to their biological children. Then we get to biological factors. So researchers again are studying how abnormalities, again, researchers are studying how abnormalities of certain areas of your brain might be involved in the development of delusional disorder. So, an imbalance of certain chemicals in your brain called neurotransmitters has been linked to the information of delusional symptoms. Then we break it down into environmental and psychological factors. So, evidence suggests that delusional disorder can be triggered by stress. So, an alcohol use disorder and substance use disorder might contribute to the condition. Hypersensitivity and ego defense mechanisms like reaction, formation, projection, and denial are some psychodynamic theories for the development of delusional disorder. So, social isolation, envy, distrust, suspicion, and low self esteem are also some psychological factors that may lead to a person seeking an explanation for these feelings and thus forming a delusion as a solution. So, with all that being said, with any disorder, how is it diagnosed? Because you have to diagnose the disorder before you can treat it. Now, healthcare providers, mainly mental health professionals, diagnose delusional disorder when a person has one or more delusions for 1 month or more. That can be explained by any other condition. So the person must also not have the characteristic symptoms of other psychotic disorders, such as schizophrenia. Now, I'm going to tell you this. If you see that someone is experiencing signs and symptoms of delusional disorder, a healthcare provider will perform a complete medical history and physical exam. Although there aren't any laboratory tests to diagnose delusional disorder, Their healthcare provider might provide or use various diagnostic tests, such as imaging tests, a urine drug screen, and of course, blood tests to rule out any physical conditions, medications, or substances that could be causing the symptoms. However, if the healthcare provider finds no reason for the symptoms, a consultation with a psychiatrist or psychologist will be made. Now, psychiatrists and psychologists use specially designed interview and assessment tools to basically evaluate a person for a psychotic disorder. They'll ask questions about the delusions and assess the person's mental status. Now, remember, the psychiatrist or psychologist may also interview family members and friends so they can provide further details about the person's delusions and a timeline of the symptoms. Now, as other mental health conditions can cause delusions, mental health professionals can carefully assess the person for other symptoms. So, a delusional disorder can be misdiagnosed as any one of the following conditions. You have what we call OCD, which is obsessive compulsory disorder. Then you have schizophrenia. Then you have delirium or major neurocognitive disorder, bipolar disorders, personality disorders, especially BPD, borderline personality disorder, and paranoia. I mentioned paranoia early. And there is something called a paranoid personality disorder. Now, as I broke it down to how it's diagnosed, basically with tests, you have to treat it now. So how is it treated? Well, treatment for a delusional disorder must often include psychotherapy. And psychotherapy is basically talk therapy when you talk to a psychotherapist. And of course, there's medication. But delusional disorder is highly resistant to treatment with medication alone. So people with a delusional disorder often don't seek treatment for the condition on their own because most people with delusional disorders don't realize their delusions are problematic or, of course, incorrect. So it's more likely they'll seek help due to other mental health conditions such as depression or anxiety. So people with severe symptoms or who are at risk of hurting themselves or others might need to be admitted to the hospital until the condition is stabilized. Then we break it down again to psychotherapy for delusional disorder. Now, again, psychotherapy is a term for a variety of treatment techniques that aim to help people identify and change troubling emotions, thoughts, and of course, behaviors. So, working with a mental health professional, such as a psychologist or a psychiatrist, can provide support, education, and guidance to the person and their family. Through therapy, people with delusional disorder can learn how to manage their system, the symptoms. Again, if you have a delusional disorder, medication isn't going to necessarily help. You have to learn to manage the symptoms. You have to identify early warning signs of relapse and develop relapse prevention plans. So types of psychotherapy include individual psychotherapy. Now, this type of psychotherapy or this type of therapy can help a person recognize and correct the underlying thinking that has been distorted. Again, individual psychotherapy. With this type of therapy, a person can recognize and correct the underlying thinking that has become distorted. And again, when people are delusional, their thinking does get distorted. And I've said it many times. What's on their mind, for the most part, is something that's untrue, but they believe in it because it is building their self-esteem. Now you have what we call CBT, which is cognitive behavioral therapy. Now, this is a structured, goal-oriented type of therapy. So based on this type of therapy, a mental health professional helps people take a close look at their thoughts and emotions, and they'll come to understand how their thoughts affect their actions. Through CBT, CBT is known as cognitive behavioral therapy. They can learn positive thoughts, or we can turn it around and they can unlearn negative thoughts and behaviors and learn to adopt healthier thinking patterns and habits. Then you also have family focused therapy. Now, this type of therapy can help people with a delusional disorder and their families. Now, this treatment involves psychoeducation regarding delusional disorder, communication improvement training, and problem solving skills training. Now, again, this type of disorder, and I'm talking about the delusional disorder, is not going to work on medicines alone. You're going to have to go through the program and do the work. You're going to have to recognize that you have a delusional disorder. And one thing that people run into when they're delusional and when they're told they're delusional, they get into denial when somebody sees that you're delusional. And I'm talking about a person who knows what a delusional disorder is. A lot of us are in denial because we don't want to be wrong. And most of us are perfectly normal people who are functioning every day in life, going through the tasks, going through the stress. We're going through everything in the real world to make it through the day. Now, breaking it down with a delusional disorder, medication. Now, am I a fan of medication? Not really, because medication basically, it helps the symptoms, but when it comes to anything else, everything is based on heredity, family. You know, if you have family that has cancer, and a lot of that go through the family members, there's a chance you might get cancer. There's a chance that you might not, because it may skip a cycle. But when it comes to medications for delusional disorder, the primary medication used to treat delusional disorder, they're called neuropleptics or antipsychotics. And these medications include the following: first generation typical antipsychotics. Well, healthcare providers have used these medications to treat mental health conditions ever since the mid 1950s. So basically, these medicines work by blocking dopamine receptors in your brain. Now, dopamine is basically a generation antipsychotics, which include thorazine or chlorpromazine. And then you also have fluphenazine, proxolin, haloperidol or Hadol, thiophyxine or Navine. Then you have trifluperazine or stetsaline. Then you have triflin or paraphenazine and thyroxine and Malaril. How do you like that? I'm not even a doctor, and I came close to pronouncing all those medical terms there. Then you have your atypical, and that's your second generation. Now, the newer antipsychotics are also effective in treating symptoms of delusional disorder. Now, of course, again, they work the same way as the first generation antipsychotics by blocking dopamine. And of course, now, instead of the dopamine receptors, you add serotonin receptors in your brain. Now, of course, these drugs include risperidone or risperidone, clozapine or Clorazil, quetiapine, or Seroquel, Geodon or Ziprasidone, and olazipine or Zyprexa. Now, these medications are hugely better tolerated than first generation antipsychotics. Now, other medications that healthcare providers might prescribe to treat delusional disorder include, we call it anti-anxiolytics and antidepressants. Now, anti-anxiolytics might help if a person has a high level of anxiety and problems sleeping. And generally, when you have problems sleeping, this gets into the area of sleep apnea. So you need to get a sleep test. Now, of course, if somebody is depressed, because as I do mental disorders, a lot of them are connected. And the biggest tool you're going to hear stress, you're going to hear depression. Now, what does an antidepressant do? Basically, it treats depression, which often occurs in people who have a delusional disorder. Now, can a delusional disorder be prevented? Well, again, since there's no laboratory way of actually checking for delusional disorder, you don't have a way to prevent a delusional disorder. So you really can't check it. You really can't check it at all, not through laboratories. So the answer to prevention of a delusional disorder, there's no way to prevent a delusional disorder. However, early diagnosis and treatment can help decrease the disruption to the person's life, family, and friendships. So, what is the prognosis, or some of us say prognosis or outlook for delusional disorder? Well, the prognosis or outlook for people with any type of delusional disorder varies depending on a few factors. The type of delusional disorder, the severity of the delusions, the person's life circumstances, including the availability of support, and of course, a willingness to stick with the treatment. Now, again, the delusional disorder doesn't usually significantly affect a person's daily functioning, but the severity of the delusion may gradually get worse. And why is that? Because most people with delusional disorders can remain employed as long as their work doesn't involve things related to their delusions. Now, the prognosis of a delusionary, or let me walk it back again, slow it down for you all here. The prognosis of a delusional disorder, again, the prognosis of a delusional disorder is basically better if the person sticks to their treatment plan. See, almost 50% of people have a full recovery. More than 20% of people report a decrease in symptoms. And of course, less than 20% of people report minimal to no change in the symptoms. Now, unfortunately, many people with this condition don't seek help. And this is what has always gotten me when it came to problems. If you have an anger problem, if you have stress, we'll go and do anything to find a job, go get an education. But when we have a health condition or even a mental health condition, what do? It goes right back. We'll either deny it or we just won't seek help at all because we don't want to deal with it. So it is often difficult for people with mental health conditions to recognize they're not well. They also might be too embarrassed or afraid to seek treatment. And without treatment, delusional disorder can be a lifelong condition. Now, here's the answer that a lot of people are waiting for. What are the complications of a delusional disorder? Well, if left untreated, a delusional disorder might lead to other issues. Depression, that word is always going to come up, depression or stress. Depression often is a consequence of difficulties associated with the delusions, social isolation. But going back to the first one, depression. Depression, often as a consequence of difficulties, is associated with the delusions. Social isolation, legal issues, for example, stalking or harassing the person involved with the delusion could lead to arrest. Also, self-harm or harm to others. This is more common in the jealous and persecutory types. Now, you have to ask somebody, how can you help somebody living with a delusional disorder? Well, I'm just going to say this. If you know anybody who has a delusional disorder, you can help by providing support and encouragement for them to seek help and treatment. But that help and treatment, it must be warranted for the person who wants to seek it. They have to see if they have a problem. If you have a problem, you have to want to seek help. It's just like motivation. I cannot motivate a person. A person has to want to be motivated. I can encourage them through some words and through some examples of what I've done to be successful or motivate myself, but it's all on you. So again, people with a delusional disorder who feel pressured or repeatedly criticized by others will likely experience stress, which may in turn worsen their symptoms. And this is because a positive approach may be more helpful and effective. Again, if you find that you're being criticized with a delusion, well, if you don't want stress to occur, a positive approach may be helpful and effective. And this is going to come from people around you who are going to support you, but you have to admit that you have a disorder. Again, the friends and family members of people with delusional disorders often experience stress, depression, grief, and isolation themselves. So it's important to take care of your mental health and seek it if you're experiencing these symptoms. Again, I will tell you, sum it all up. It's important that a delusional disorder, you understand that it is a mental health condition. So as with any mental health conditions, you must seek help as soon as possible. And I'm going to give you an example. If you have a car and you know you're seeking problems in that car, you're not going to wait till more problems occur. Why? Because you're going to end up paying more, because now you've got other problems that occur. And I'm putting it in layman's terms so you can understand it. So if there are any symptoms that appear, you got to seek help as soon as symptoms appear. And why is that? Because when you seek that help, you can also get a decrease in disruptions to life. So again, seeking help as soon as symptoms appear can help decrease the disruptions to life. So many health professionals can offer treatment plans that can help manage thoughts and behaviors. Now, again, there are a number of individuals who are delusional. And in life, when we have issues, a number of us don't want to deal with our issues. This is why we blame others. If you have a problem and it is going to save your life, seek help. I think a number of us need to seek help sometimes. We need to take time to also read about the symptom that we have. See, a lot of us, we want to come in good faith. A number of us have problems. Now, we might not know it because we're going through life every day, normal, like nothing is happening. And the biggest fear that I have with delusions You can culminate it with denial. And this is why you can't talk to some people. And I know there are a few YouTube shows that I watch, and I'll give you an example. I watch some of Kendra G's stuff, and there are a number of ladies who come on her show, and they're extremely delusional. And shout out to Brother Nate. He had someone on one of Kendra G's videos. She may have sounded good, but she sounded cuckoo for Cocoa Puffs because she was going in and out, back and forth. What she was trying to do was over appraise herself. And when she got stuck, she would walk it back to something else. Or when you change the subject, deflection is another term for, well, I can't answer the question, or I'm going to deny it. And this is what goes on with a lot of people. And to me, when you live in deceit, lies, and deception, you're not just hurting yourself, but you're hurting other people. Now, a lot of us, when it comes to delusion, some of us don't know we are being delusional. But let me break it down into some common sense. You can wish in one hand and spit in the other. And what do you have? You have a spitty hand. That's an old saying, old wives' tale. Let me break it down in real terms here. If you understand the truth and reality, because, I know they were talking about purgatory. That's the biggest one. I think the one where an individual over appraises themselves is the biggest one, because some of us do become something that we're not. Like, I know in these Black YouTube spaces, there are a number of the women who talk about they're entrepreneurs. Okay. If you really break it down, what are they really doing? Do they really have a business, or are they self-employed? It's great to have a business, but when you start asking the right questions, you'll find out that they really aren't entrepreneurs, or some of them could be making their money from YouTube. I'm just giving examples. But a number of us, when it comes to living a credible life, many of us want to live a credible life. But many of us, when we get down, we always want to say something to make us feel good. Again, you can't base everything off of feelings either, because feelings will get you in that mode of denial. See, the truth never changes. Facts never change. Feelings do change. And if you're guided by your feelings, you're always going to have problems. You're going to have problems because there are going to be times where you're going to avoid the truth. And I know the truth is very hard to deal with for a lot of us. We don't want to hear it. It's unpleasant. But it can also motivate you if you take action. Now, when it comes to delusion, again, I also look at it as a self-esteem measure. That's why individuals overpraise themselves. So one thing I will say, get to know yourself as well. Admit when you're wrong. Now there's this SBE, shame, blame, and explain. I don't use that term, and here's why. That can also be equated with delusion as well. If somebody is always backpedaling, or somebody's always shaming, if somebody's always blaming, that means you're not taking responsibility for yourself. And you have all kinds of occurrences that are going on throughout your life. I know in these spaces you've heard the terms red pill and blue pill. I used to use the term red pill a lot. I will say this: to be red pill, you have to go much further than women. I know there's red pill rage. Well, I'm going to drop that red pill rage and just call it jealousy or anger. There's just some people up here that just want to pick fights here in social media because they don't have anything to do. Is it red pill rage? Not necessarily. It's that some people don't know how to deal with their situations. And what happens when people get delusional and they're found out that they're delusional? Their ego gets busted. So what do? Some of them shame, blame, and explain. And usually their explanations are always flawed because what they were dreaming of was untrue anyway. So my suggestion is understand how the real world works. And if you have a problem, understand that you have a problem, don't deny it, and seek help. It'll be better for you and better for the people around you. And that's my commentary for this edition of the 411 Talk Zone radio show right here on YouTube. If you like what I just presented, please comment, share, and subscribe. Let's get the likes up. Let's get me some more subscribers. I'm at 2,100 or just over 2,100. Again, I do take cash apps. That's $LEJ01021965. That's only at your discretion. I'm gonna keep producing content from a psychological standpoint and a common sense standpoint as well. And I will have a live stream up again next Wednesday at 7 o'clock. Now, here on the 401 Talk Zone radio show, I research everything I do. There are times I'm right and there are times I'm wrong. All I'm doing is providing information. Now, there's another channel I have out as well. It's called the QCIS channel, formerly the Mind of STEM channel. On that channel, I give you a daily dose of science, technology, engineering, and math. Now, if you cannot find the 401 Talk Zone radio show or the QCIS channel on YouTube, you can always check me out on Twitter. Whether I do a live stream or I do a pre-recorded video, I'm going to post those videos on Twitter. Now with the QCIS channel, I'm going to take it one step further since it's an educational channel. I'll also post the QCIS channel on Twitter. And at the end of the day, be blessed for what you have. Don't worry about what you don't have. Always know that the sun rises in the east and sets in the west. And for individuals who are delusional or they're not delusional, I will say this. If I'm not talking about you, don't be the first to respond because you'll be guilty. So this is what I'm going to say for you. If you're not the one I'm talking to, but if you are the one that I'm talking to, heed this advice as well. If it doesn't apply, let it fly. But if the shoe fits, wear it. If you don't like the shoe, change it. Once again, thank you for listening to this edition of the 411 Talk Zone radio show right here on YouTube. Till next time, my name is Leon Jones. I want you to have a wonderful and gracious evening. God bless you. I'm out.